Slow heart rate, symptoms and treatment. Bradycardia or slow heart rate refers to a resting heart rate that is slower than usual. A heart rate of fewer than 60 beats per minute may indicate an underlying health issue, but this is not always the case. According to the American Heart Association, a person's resting heartbeat is generally between 60 to 100 beats per minute. However, people who are physically active or athletic may have resting heartbeats that are as low as 40 beats per minute. A person's resting heart rate can also drop during deep sleep. Additionally, a slow resting heart rate can be a result of certain health conditions. Watch on to learn more about slow heart rate, its causes and treatment options. A person's heart is responsible for pumping blood throughout the body. The heart consists of four chambers: right atrium, left atrium, right ventricle, left ventricle. The top two chambers, the atria, receive blood. The bottom two chambers, the ventricles, pump blood from the heart. Blood has many functions such as transporting oxygen and nutrients to tissues and organs, creating blood clots to stop bleeding, transporting antibodies to fight infections, bringing waste products to the kidneys and liver, which then filter and clean the blood, regulating body temperature. The American Heart Association states that generally a resting heart rate of less than 60 beats per minute means that a person has bradycardia. An individual who has bradycardia may not get enough oxygen-rich blood to certain areas of their body. If left untreated, bradycardia can lead to life-threatening complications such as syncope. However, a person may naturally have a slower resting heart rate due to physical fitness or age. If an individual is concerned about their slow resting heart rate, they should seek guidance from a doctor. Symptoms. Some people who have bradycardia do not experience any symptoms other than a slow heart rate. Other individuals with bradycardia may have symptoms such as feelings of exhaustion and weakness, fainting or dizziness, confusion, shortness of breath, exercise intolerance or difficulty breathing when working out. If a person's bradycardia is due to a serious medical condition, it can cause life-threatening complications if left untreated. Complications of untreated bradycardia include cardiac arrest, facial, head or orthopedic trauma from fainting, chest pain, low or high blood pressure, heart failure, kidney failure from low cardiac output. Causes and risk factors. A person may experience mild bradycardia or only have symptoms from time to time. If they notice that they have a slow heart rate, they should speak with a doctor to determine the cause. Bradycardia will not always require treatment. If a person does not have any other symptoms and has a structurally normal heart, their bradycardia may be due to an additional factor, such as physical fitness. People who engage in high amounts of physical activity tend to have more efficient hearts. This may slow their pulse because their heart does not have to pump as hard or as fast to supply blood to the rest of the body. Certain medical conditions can cause bradycardia. These conditions include sick sinus syndrome, also known as sinus node dysfunction. This condition affects a person's sinoatrial node, a structure in the top of a person's right atrium that generates the electrical impulse that starts a heartbeat. This can mean a person's heart rate speeds up, slows down, or does a combination of both. Other symptoms of sinus node dysfunction include palpitations, where a person's heart feels like it is fluttering, pounding, or pausing; tiredness, lightheadedness, feeling faint or fainting. Although sinus node dysfunction can develop at any time, the average age of someone who has it is 68 years old. Sinus node dysfunction is a common cause of bradycardia. Other heart electrical issues. If the heart is unable to send electrical signals due to a blockage or heart disease, this can lead to bradycardia. Complete heart block is when there is a total loss of communication between a person's atria and the ventricles. This occurs when the SA node is unable to pass a signal to the AV node. Complete heart block results in a person's atria and ventricles activating independently of each other. It can be fatal if a person does not receive treatment for complete heart block quickly. Metabolic issues. Some metabolic disorders can slow the heart rate. One of the most common is hypothyroidism, which is when the thyroid gland does not produce enough hormones. Hypothyroidism can affect the health of the blood vessels, which may slow the heart rate. Thyroid disorders are common and may affect young and otherwise healthy people. Between 4 to 10% of individuals in the United States have hypothyroidism. Other metabolic conditions that can cause bradycardia include acidosis, a condition where there is too much acid in bodily fluids; hyperkalemia, where a person's potassium levels are too high; hypokalemia, which is when a person's potassium levels are too low; hypothermia, which happens when the body temperature becomes too low. Heart damaging conditions. Damage to the heart due to certain conditions can cause it to pump more slowly and less effectively. Conditions that can damage the heart include congestive heart failure, coronary artery disease, heart attack, myocarditis, which is inflammation of the heart muscle, Lyme disease, thickened heart muscle, hypertension, diabetes. Heart medication. Certain medications, including those for heart disease and high blood pressure, may lower heart rate. Beta blockers or calcium channel blockers, which doctors prescribe for a rapid heart rate, and some other heart conditions may also slow heart rate. Individuals taking a new medication who experience symptoms of bradycardia should contact a doctor. Oxygen deprivation. Hypoxia is a term that health experts use when a person is unable to get enough oxygen to the tissues of their body. Hypoxia is a medical emergency and can occur when a person is choking or having a severe asthma attack. Chronic medical conditions such as chronic obstructive pulmonary disease may also cause hypoxia. If hypoxia lowers a person's heart rate, it is essential to treat the underlying cause. Treatment options. A doctor may not always need to treat a slow heart rate. However, when a slow heart rate causes serious health problems, it is essential that a person receives treatment. The treatment an individual receives for their bradycardia will depend on the underlying cause. A doctor may use certain tests to diagnose the cause of a person's bradycardia. These tests include physical test, questions about medical history, blood test, heart monitors, imaging test. If a person has a condition that interferes with the electrical impulses of their heart, they may require a pacemaker. This is a device that is implanted under a person's skin and connected to their heart. The pacemaker then sends impulses to the heart that cause it to beat regularly. Depending on the cause, a doctor might also recommend changing heart medications, taking medication to treat thyroid or other metabolic disorders, making lifestyle changes such as eating a low-fat diet, getting more exercise or quitting smoking, monitoring heart rate or blood pressure frequently,